Hello and welcome to Business Insider with Mario Toneguzzi on YYC Business, brought to you by MegaPixx Media. Joining me today is Mike Meldrum, who is President and CEO of the Calgary Health Foundation. Thanks, Mike, for joining us today.
Thanks for having me.
Let's talk about a really cool and neat initiative that's being undertaken here in the city. Partnership with the Foundation, Oxford Properties, and Ellis Don Construction on building respite areas in hospitals. Can you tell me just a little bit about the initiative and what that entails?
Yeah, it's a great initiative. We have been thinking and actually doing quite a few things to support healthcare workers over the last 18 to 20 months, just recognizing the burden that they have faced on the front line in our health system. And so we've done lots of different things, but probably a good year ago, Jeff Fox from Ellis Don had engaged with the Foothills Medical Center about some project or initiative that they could do that would help the healthcare workers. And they came up with the idea of renovating an outdoor space as a respite space that would help healthcare workers to be able to get away and sort of rejuvenate in the busyness of COVID and the pressure that they're experiencing. And that idea was shared with myself and also with Dave Rutledge out of Oxford Properties. And then the conversation was, this is amazing. How could we bring it to the other 3 adult acute care centers in Calgary? And so it really went from there. And it's just a great initiative. It not only is a bit of an initiative showing gratitude immediately, but it has obviously some very functional long-term benefits to the healthcare workers to be able to have these spaces that they can access. So that's kind of how it got started a little bit. And Oxford and Ellis Don, hat off to them for showing corporate leadership in this. I think they're just authentically wanting to say thank you and also to do something that's meaningful and impactful for healthcare in our city.
Can you talk a little bit about the specifics of this? Like what, where are these places located at the hospitals? How big are they? Like what will be in there?
Right. So the Foothills one is done now and it's open. And so we actually have some great feedback about, how often it's being used. And it's designed, at each of the sites, it's going to be designed a little differently based on the needs and the space that they have at the site. But the principles of design are really around a space that's sort of away from the rush and the hustle of and the beeps and buzzes that are in a busy hospital. Allows people to sort of get away and take a break. Some group seating is available, and also some privacy screens, that allow people to sort of get away from people a little bit, have a bit of a quiet time, whether it's by themselves or just with 1 or 2 colleagues. So there are seating areas. One of the Foothills is an outdoor space, and I expect that may be the case in the other sites too. But again, we're in design phase of those, so I don't know where they're going to land. But I do know that the principles of nice seating, aesthetically looking quite nice outside. In the case of the Foothills, they actually have it in a place where they actually have food trucks that drive up adjacent to the space. So it can be a bit of a lunch area and a bit of a it can be a bit of a gathering place as well. But again, it's structured such that it's not sort of auditorium seating so that everyone's there, but it allows people to sort of have some private conversation and really get away and get outside.
Why is this important?
And there's probably different thoughts of this, but I think most people understand. I think COVID and the pandemic has helped us to understand more the burden that healthcare workers face, especially with the way that the pandemic has rolled out, right? We're talking now 4th wave, right? This by definition means that there's, the clouds start to part, the sun comes out, and then gather again and the rain comes, right? And so it has been up and down. And I think that there's been a lot of good coverage and reporting about the challenge that it is from a mental health standpoint, from a just fatigue and energy standpoint for the healthcare workers to be on the front line, and they're compassionate, right? They want to help everyone, and that's not always possible. And so I think there's a lot of understanding and empathy about the the challenge that they've had over the last 20 months. And that, that challenge has probably always been there to some degree. So this helps, but it's been exacerbated, right, by COVID. And we've also learned more about it. And I think one of the other things that I think is important to note is that, in our public health system, it may not always be possible to develop the best staff spaces within the facility, with their priorities mostly being patient care. And yet we know there's a tie between the care a patient receives and the energy and the mental health of the staff that are delivering that care, right? And so, but not always is it possible for the budgets to invest in that. And so, what effectively has happened here is philanthropy has come forward to say, we'll help out with the costs of this, and we'll help to make this happen. And Ellis Don and Oxford and the Fundraising Associated are helping people to draw in and have their dollars having, develop a meaningful space that will help not only the healthcare workers, but I would argue help the care that's delivered to patients.
Okay, and you mentioned the fundraising. Can you talk a little bit about that? You're looking for help and support in that area to do this project, right?
Absolutely. I mean, Ellis Don has put a lot of, not only put some of their own dollars in, but has certainly leveraged their network from a construction and their knowledge of sort of construction within a health environment, which is very different. So they've put a lot of sort of gift in kind, and as well as some donation and certainly a lot of effort and energy in. And Oxford has put, contributed financially to support this. But most importantly, they're both sort of advocating with this along with the Calgary Health Foundation. And we're all trying to invite people that want to show their gratitude to healthcare workers. This is an easy way to do it. Make a donation of any size. If there's, there's probably a number in the corporate community that see this as a real nice opportunity for them to get involved. And we would just welcome the conversation about how they can be involved and really make a difference. And so it's really something that, anyone, whether it's an individual that is really wanting to say thank you to a healthcare worker, or it's a company that's saying, this aligns with our values. And we're looking for a way to say a meaningful thank you to those on the front line. We'd be happy to talk to them. And there's also a way to make online gifts to support that.
Okay, super. While I have you here, Mike, I just wanted to ask, can you maybe talk a little bit about the foundation itself? What is the Calgary Health Foundation and what do you guys do?
Yeah, I would love to. So, the Calgary Health Foundation has been around for 25 years. Just last year, we changed our name from the Calgary Health Trust to the Calgary Health Foundation. So just to help people put it all together. But it was actually founded back in 1996 by Bud McCaig and a number of other community leaders. So well known in the community that just really wanted to be, to have some efficiencies with respect to back office, with respect to fundraising for the hospitals in Calgary and for healthcare overall, and saw it as an opportunity to bring together existing foundations. And so there were 6 separate foundations that really were consolidated to become the Calgary Health Foundation. And the vision was really to advance healthcare. And we've stuck with that vision all the way along. And our tagline nowadays is relentlessly advancing care, wellness, and research. And so we remain focused. What is interesting for people to understand is we do actually represent the fundraising for the 4 adult acute care centers in Calgary. So the Foothills Hospital, Foothills Medical Center, the Peter Lougheed Center, the Rocky View General Hospital, and the South Health Campus. And we also are the, fundraise for the long-term care facilities in Care West. So there's 13 Care West facilities long-term, and also for community health. So we have a real big scope in advancing care in our community, and we're just laser focused on making those investments in care, wellness, and research that really benefit all of us in our community. So that's a little bit about our foundation, and we have strong support. People will also know us from the hospital home lotteries that we conduct. So we have the Foothills Hospital Home Lottery and the Hospital's Home Lottery that are strongly supported in the community and allow us to really make a real difference with the proceeds from those initiatives. So
yeah, exactly. Well, super. Thanks, Mike, for joining us today.
Thanks so much for having me. Great to chat about these things.
All right, super. That was Mike Meldrum, who is president and CEO of the Calgary Health Foundation. This has been Business Insider with Mario Toneguzzi on YYC Business, brought to you by MegaPixx Media. Thanks for joining us.